The life expectancy has increased from less than 30 years to 72 years, and after 2 centuries of progress, we expect to live much more than twice as long as our ancestors. The global population projected to reach 11 billion in 2100. Today, we are about 7.9 billion population globally. And can you imagine the immense pressure it will have on healthcare? Let me dive into the presentation. By 2050, one in 6 people will be over 65 years old, and more people will live with one or more chronic diseases. Chronic diseases are, for the people who are not from the healthcare, are diabetes, cardiology, the hypertension, the blood pressure. And the population growth, aging, and the emergence of personalized medicine, which Douglas talked about, will increase demand for services and affect the performance. And I just talked about how the COVID-19 has revealed how vulnerable the healthcare industry is to change. By 2040, healthcare as we know today will no longer exist. So be ready for the change. The healthcare consumes 18% of the GDP in US, 18%, which is equivalent to $3.6 trillion, $3.6 trillion a year. And in other rich countries, it's about lower than 10%. Just imagine the burden on the healthcare in the US, $3.6 trillion a year. And this digital technology is transforming the healthcare in US as well as globally. How many of us, we all know the companies Alphabet, Amazon, Apple, Meta, which was Facebook, Microsoft. We all think these are IT or technology companies. But let me tell you this data, which I also read it yesterday night. All these companies which I named have together poured about $3.6 billion in the health-related deals in the last year. Only last year, all these IT companies or technology companies that we have heard are putting a lot of money in the healthcare-related deals. So just imagine all these companies are gearing up towards the healthcare. So one of the examples you'll see the Google Health, which has developed an artificial intelligence tool, Google DeepMind, which has an algorithm to outperform all human radiologists on pre-selected data set to identify breast cancer on average by 11.5%. So if you have 100 patients to target or to find out this cancer, with this artificial intelligence, you can actually improve your progress, improve your processes, where you can identify more patients who will have gone or going through the cancer in the breast cancer. So this is amazing, where the IT or the artificial intelligence is helping the medical profession. So we are talking about the digital technology and see how pervasive it will be into the human body. Just imagine the amount of data we will be transmitting to the healthcare professionals or to the global companies of our own bodies. It's scary as well as beneficial, but as human beings, we are learning how to use this data and how privacy could be maintained. So on one hand, it's really blessings, but on the other hand, it's the real scare and the fear how this technology will help or will not help the humanity going forward. So it still remains the challenge to see how the society or how the governments will regulate all these devices, how the data will be regulated, how the data will be tracked. So this is the challenges which human beings face, and also the healthcare industry is facing. But again, this is amazing technology where we all benefit from the advancement. Drug development, Douglas talked about, I'll briefly mention because of the industry 5.0, which Asif just mentioned a while ago, and I see a lot of pharmaceutical industrial people sitting here. This will actually, Just imagine the drug development. Douglas mentioned exactly the numbers and the data. Just imagine if this actually comes into the reality, the clinical trials, where you have the human, virtual human. You will save the time and the amount of resources on the clinical trials. So the faster you saw the development of COVID vaccine and many drugs in the last year, which Douglas mentioned, is all because of this augmented reality, artificial intelligence, and the human genomics, which can help the pharmaceutical companies to exactly develop the compound and the drugs for the benefit of the patients.